All right, I would like to call the Joint Board of Health and Hospitals meeting to order. And our first agenda item is approval of the Zoom video from May 19th, 2022 as the minutes. Do I have a motion to approve that video?
I move.
Thank you. Second?
Second.
Thank you. All in favor, say aye.
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 Opposed, no. Abstentions? Okay, looks like it carries. All right, so our next agenda item is our COVID-19 update from Dr. Mahdi.
Good morning, everyone.
Morning.
Please bear with me while I start sharing slides. Are you seeing the notes view or the normal view?
Now the notes view.
Notes view.
And now?
Yes,
That's
good.
perfect.
Okay, let's get started. I'll be presenting the COVID-19 data update today. This has been prepared by our senior epidemiologist, Matt Haslam. I would like to draw to your attention that we spotlighted Matt Haslam in our employee spotlight this month. Matt has been an absolute champion and leader for this region since the beginning of the pandemic. He has independently and solely been responsible for these COVID-19 updates for the duration of this pandemic. What you see on our website and our dashboard, he takes on a lot of other large projects, including behavioral health updates, our monthly cure violence prevention monthly reports that we've begun doing, and a slew of others. He is a thought partner and innovator, and he cares deeply about public health in the city. So I just wanted to shout him out at the beginning of this and say that if you didn't catch the employee spotlight on all our social media channels, please do. And please show your appreciation for Matt as he keeps us informed and has done for this entire pandemic and for these Board of Health meetings. So the data that I will be presenting today will be from July 20th. So the average daily case count is currently 96.9 confirmed cases per day, and case counts have plateaued at approximately 100 cases per day for the past 6 weeks. Here we're looking at the epidemic curve. This is remaining constantly elevated since the end of May. So what does this mean in layman's terms? This means we are currently in a surge and have been for quite some time. Many of you, I know, have friends, colleagues, and community members that have tested positive for COVID in the last month or two. It is because we are currently in a surge, and that's important to say from the outset, because with or without pandemic fatigue, this virus is still very much with us. Testing and self-isolation when positive remains critically important to protect others. So residents need to routinely test themselves before and after attending high capacity events if they have a known exposure or if they develop any symptoms. So here we're going to look at the Missouri State sewer shed COVID cases and fragments in sewers. This is through July 10th. So viral loads in wastewater correlate strongly with diagnoses and is a helpful surveillance tool to estimate the true extent of the pandemic across the state, because it doesn't rely on people going for testing. Testing dramatically decreased since about January. We saw a very significant drop off. So this is another way that we can monitor surveillance. The most current data shows viral loads slowly but steadily increasing across Missouri, as you can see before you. Case counts have been flat in the St. Louis region, so the increasing trend is due in part to other regions of the state having increased transmission. Recent sewer sheds, and so this is another way of looking at that. You can see the increase in red, no change, and gray. And so the recent sewer shed surveillance data shows increasing viral loads in a number of surveillance sites in the St. Louis region, as indicated by the red circles on the map on the left. Yellow circles indicate no change. 3 sites in our region reached a statistically significant elevated viral load And you can see that map on the right. This data provides further evidence that transmission remains high in our community, and we need to continue to be on high alert and treat it as such. So let's talk about the Omicron variants of concern. Omicron sublineages BA.2.121 had been the predominant variant in circulation in our region, which is HHS's region 7, until recently. 2 additional strains that you've seen a lot of in the news, BA4 and BA5, have quickly taken over now and represent roughly 90% of new cases. To show you how rapid that change was, a week to 10 days ago, that statistic was 56%, right? And so it became the predominant variant from 56% to 90% in just under 2 weeks. These variants have also been detected in similar proportions in the St. Louis region through sewer shed surveillance. The transition from BA.2.1.1 to BA4 and BA5 variants are contributing to the sustained high levels of infections. Why is that? High school biology, viruses, and especially viruses that are this prolific. So it's survival of the fittest, right? When they mutate, they mutate and they will find the fittest. The fittest will survive, and the fittest are the ones that are most evasive, the most highly transmissible. And what we worry about is that they then translate to being the ones that cause the most significant disease and death. And we'll talk about that soon when we look at hospitalization. You know that I've been trying to orient you to the new CDC community level metrics. These are now consistently on our dashboard as well. Currently, the city is in the high risk category for the CDC's community level metric and has been for quite some time. We've dipped back down to the medium level due to the reduction in tests done over the July 4th holiday weekend, but rebounded back to the high level shortly afterwards. There are 2 metrics here, community levels and a transmission level. In layman's terms, the transmission levels doesn't take into account what's happening in hospitals. So even when we take into account hospitalization rates, we are in a high risk category. Again, I hope you're getting the overall trend here. We are in a surge, things are serious. This pandemic is still very much with us. The regional hospitalization rate has climbed to 16.2 admissions per 100,000 residents, and the percent of beds occupied by COVID patients has been slowly increasing. These metrics indicate a high risk of transmission in the community, and residents need to take precautions by wearing a face covering, a mask, an N95 mask when indoors and around vulnerable people, and social distancing whenever possible. I'd add in crowded spaces as well. So now we're going to look at COVID-19 case density by ward and region. The brightest spots can be found in the Central West End, followed by areas around Tower Grove Park, downtown, and the Hampton neighborhoods. Proximity to the BJC hospital system is likely contributing strongly to this bright cluster because of the routine testing done at these larger institutions. Universities similarly do routine testing, and one interesting observation we have is the bright spot previously seen around SLU's campus in Midtown has cooled off now that students are on summer break. So now we're going to look at COVID-19 case demographics by race. Currently, Asian residents have had the highest daily case rate at 34.8 cases per 100,000 per day, which is 16% higher than incidence among African Americans and 27% higher than Caucasian residents, who now have the lowest case rate. An important note, race is currently unknown for 28% of cases diagnosed, which complicates analysis of trends by racial group. So these rates should be interpreted with caution. It's the importance of having equity-based approach to data collection and data reporting. When 28% of our population are not even represented, we have a lot of work to do. These rates also do not reflect unreported cases, such as those who test positive with an at-home antigen test. Unfortunately, I believe that at a national level, we needed to be proactive about a standardized reporting mechanism for these tests. And without that, we're missing a really critical piece of data. We're going to now look at COVID-19 case demographics by age. Per usual, adults aged 25 to 44 currently have the highest daily case rate at 49.7 cases per 100K. Rates among young children have increased dramatically in the last few weeks, and older adults age 50 have seen increasing trends. In contrast, school-aged children 5 to 17 have had lower case rates. Note that these rates do not reflect unreported cases, such as those who test positive with an at-home antigen test. So I wanted to talk to you about new and current COVID-19 hospitalizations. In layman's terms, the reason that we're not seeing as much of an impact as we did with the Omicron surge in December is because of this graph before you. In just looking at hospitalizations, you can see that while the volume and overall density of cases has been higher in the St. Louis region than even around the Delta surge of last summer, the impact in disease severity, hospitalizations has thankfully not been as high, but look at where that curve is going, right? Look at the upward trend that we are seeing currently. So the number of people currently hospitalized in new hospitalizations remains lower than previous waves, but we have been steadily rising. The current waves of cases has plateaued. So we might expect hospitalizations to do the same in the coming weeks. That is our hope. But this is the time for action. This is the time for leaders and community members to really stick in and do what they need to do around mitigation strategies. Because if we don't take advantage of this place in the curve, it could continue to go up versus plateau and come down. So we're looking at peak inpatient census projection scenarios for STL hospitals. So modeling from BJC Center for Clinical Excellence and the Pandemics Task Force had previously suggested that we may have already passed the peak in hospitalizations for this current curve. But like I just said to you, unfortunately, they updated their models and now expect hospitalizations to continue to slowly rise, a consequence of this extended period of high transmission that we find ourselves in. Vaccinations continue to be the best tool in our toolbox to reduce the risk of hospitalizations, and therapeutics are now available to further reduce the likelihood of severe cases. I've spoken here previously about test to treat programs, encouraging folks to use their primary care doctors if they don't have them, our federally qualified health centers, and our CVS and Walgreens that have federally approved test to treat programs where you can get tested and be screened for available therapeutics that decrease your chances of severe illness or death. This is really important right now. So when we look at deaths, fortunately, COVID-19 case fatality rates has fallen over time due to the improved immune protection conferred by vaccines and natural immunity from prior infections. This decoupling of cases and deaths can be observed when comparing the Omicron wave this winter to the number of deaths during the Alpha wave, which is the B117, over the previous winter in 2020 and 2021. So if you just look at how these waves have gone, you can see how these life-saving and transformative vaccines and natural immunity have been helping society, even though we haven't reached that elusive herd immunity. There were fewer deaths as a result of the Omicron wave, despite having a far greater number of cases diagnosed. So let's talk about vaccination rates. The number of first, second, and third doses being administered has decreased to a slow and steady pace, but boosters saw an increase recently with the CDC's recommendation for a fourth dose and our internal campaign around boosters here at the Department of Health. And that specifically was for folks aged above 50 and immunocompromised individual. St. Louis City is now 60% fully vaccinated, and less than half of those who are fully vaccinated have received a booster, which is where the bulk of the campaign is and where we need your help as trusted messengers and leaders in the community. Zip codes in North St. Louis continue to lag behind Southwest zip codes and overall vaccination initiation rates. That's the map on the left, but have generally had faster rates of change in recent weeks, again, because of our equity-based campaign to really support our most disenfranchised and minoritized communities. The rate of change of vaccination continues to slow down. Zip code 63113 saw the greatest increases in vaccination percent, with the 1.3 increase in the rate over the last month. Higher rates of change in northern zip codes indicate the vaccination gap is slowly closing, but these rates are still far too low. So we're going to talk about our vaccination rates in children. Currently, 51.1% of eligible school-age children have received at least one dose, and 44.3% had completed the primary series. Only 8.8% have received a booster dose, but eligibility criteria was expanded not too long ago to include children above 5. This is another really important area of focus. Children living in predominantly African-American zip codes have much lower vaccination rates. 25.6% have completed the primary series compared to 63.8% of children in predominantly Caucasian zip codes. I've had conversations with the White House Task Force, and they tell me that St. Louis is one of few cities in the US for which this level of disparity is this significant. I'm going to pause here because I just need you guys to take that in. and for us to really be thoughtful about how we're going to continue to support the Department of Health. Our board chair has been really clear with you since she's taken on this role about how can I be a better communicator in getting support from you, and how can you best support me? So I've been very clear throughout this presentation where the points are, where we need support, we need your voices, we need collaborations. You have the zip codes. You see where the disparities are. This is where we need your help. Severe disease is rare in children, but inequities in vaccination rates may exacerbate other health or socio-development inequities, compounding disadvantages. So the biggest feedback I get is children don't get that sick, so why should we subject them to this? We don't know what the long-term impact of even mild symptoms are. Long COVID is very much with us. And there are other public health related impacts of children having COVID, being out of school for long periods of time, behavioral health issues, right? And so we cannot take that attitude around our children. We need to protect them with these life-saving vaccines. So let's talk about updates in vaccine eligibility. Immunity has been observed to wane over time, meaning a third or fourth dose of vaccine is necessary to keep your immune system up to date. The age criteria for getting a booster was recently expanded to include children aged 5 to 11 for Pfizer only. A second booster was recommended for older adults age 50 and above, and for anyone 12 and older who's moderately to severely immunocompromised. The FDA and CDC have also now approved both Pfizer and Moderna's vaccine for young children aged 6 months to 5 years after demonstrating safety and efficacy. This long awaited, and I say this of a mother of a 2-year-old, knowing what that wait has been like for mothers in our community, will finally allow parents to get our young children protected. Please encourage friends, colleagues, and members of the community to do this. So I think this is my last slide. No, I lied, one more after this. A paper published this month in the New England Journal showed that the recent subvariants of Omicron have all substantial evasion antibodies, even in vaccinated individuals. The left chart shows antibody titers in vaccinated participants before and after a third dose booster. And you can clearly see that the booster dose really ramps up the immune system and provides protection against all Omicron strains. The chart on the right shows titers for people who are infected with the original Omicron strains, BA1 or BA2. Similar to being boosted, these participants also had good protection against subvariants. This study underscores how important getting boosted it is to maintain immunity. Little nerdy, little science. That's what you get for making an ID doc, your director of health. But I need to show this because this sort of complacency around boosting, you need to understand how this is helping your immune system to stay strong and fight disease, right? Whether or not you have gotten COVID in the past and you were fortunate enough to just be twiddling your thumbs at home and watching Netflix, you don't want to put yourself in a position to potentially have long COVID, which is really dramatically impacting a lot of Americans and people around in the world right now. Last slide, I promised. Simultaneous COVID and flu vaccination, we need to talk about and thinking about the path ahead, right? So a study published in JAMA last week found that people who received an mRNA COVID-19 booster vaccine and a flu vaccine at the same healthcare visit were only 8 to 11% more likely to report systemic reactions. So headache, fatigue, muscle pain, than after receiving just the booster alone. So the implications, get the COVID and flu shots at the same time this fall. Studies have shown that you don't have to separate, you don't have to wait. It is fine to get both as soon as the flu vaccine is available. If you're eligible for a booster, get them this fall. We know that winter is the hardest time for transmission because of having to be indoors and cold and difficulties with adequate ventilation in general. Administering the COVID-19 vaccines at the same visit is important because it increases the probability that people will be fully vaccinated and up to date, especially for patients who are uncertain to return for additional vaccinations. I said a whole lot of words. You got real sciencey there and you hung tough with me. I saw a few smiles, head nods. I appreciate y'all. Let's discuss and take questions. Thank you.
Tim, I see you have your hand raised. Would you like to start?
No, thank you so much. And thank you, Dr. Mahdi, for another fabulous presentation. And I don't mind the nerdy science stuff at all. And I want to give you shout out for calling out Matt for his great work. And I think that's great that you're doing this on a regular basis, calling out your staff, because you have increasingly excellent staff. You had it already, but you're adding to it, as we know. So another excellent presentation. And, you know, we keep on thinking we're going to get through the pandemic, but we're not getting through it. I want to sort of try to connect two slides if I can. I was sort of a bit alarmed by the slide that had the COVID rates by age.
Mhm.
And you pointed to that slide with a yellow line that had the rates with the youngest age group had a pretty alarming increase in COVID rates. If I read that right, and if you want to pop it up again, you could, but I want to correlate that with the low vaccination rates that you showed towards the end, and see if you could talk about that, because I just want people to see sort of that increased COVID rate for those youngest folks seemed to me to be pretty dramatic.
Very dramatic. So let me pull this up again. Remind me which slide you want me to pull up?
It was, if you scroll, it's 1 by 8. It looks right there, number 9, maybe.
This one by age?
Yeah. Yeah, that looks like the 0 to 4 and is the lightest yellow. And I think that's what you can speak to it.
It's not cooperating. Hold on. Sorry, Dr. McBride, I'm having a tough time pulling it up for some reason.
Or you can just speak to it.
It was up just now.
Was it up?
Yeah, it was up. We saw it.
It's not showing as up on my computer. Okay.
Slide number 9 is what I was calling out.
Bear with me, folks. No coffee this morning, but we get it. All right.
There you go. Thank you.
So you can see here that while this age group, these lower age groups have had lower rates, this trend here should alarm you. You don't see a steep uprise in cases in this age group, right? These are our children that can't mask because they're the youngest. These are the age group that haven't been eligible for a vaccine until literally 2 weeks ago. And this is also the age group where, if you think about trust and fear for a vaccine, right? As a parent myself, and again, health literacy doesn't get much higher than an ID director of health. But even as a mom, my husband, who's a pediatrician also, we really had to sit down and discuss the risks and benefits for our child. And we have the capacity to really in-depth look at those studies. A lot of parents and caregivers have a lot of pause, need to have conversations. So to have this and simultaneously to have the level of disparity that we're seeing in Black and Brown communities and children is a reason for distinct alarm. So what is the charge here? We need pediatricians to partner with us. I'm working with that at the health department around campaign and messages. We need them, especially from Black and Brown communities, so that caregivers and parents who are struggling with this decision are hearing from people who are equipped to talk to them about the risks and benefits and to answer their questions, but also have that representation from someone from their community who may understand a lot of the structural determinants around barriers in this decision-making. We need to use the zip code level data that we have consistently been giving you to have collaborative vaccine events. Why is this more challenging? Well, obviously in children young in age 0 to 4, right? A dingy, dark health department setting with people that you've never known and volunteers is not as appropriate as it may be for adults, right? With adults, you saw me at the Metro train link putting vaccines in people's arms. We can't bring young children. So we've got to find collaborative partners, right? Our FQHCs, our healthcare systems, mobile vans now that we have summer in hopefully not too hot environments that are safe and with healthcare providers that people trust. For that reason, we've been leaning more into the healthcare provider settings, the CVS settings, and the FQHC settings, where those people have that level of expertise to work with young children. But I think it's multifactorial, and it has to be a combination of education, clear, consistent, high-level communications around this alarming trend, as well as finding innovative ways to provide safe, comfortable spaces to get vaccines to this young age group. Does that help, Dr. McBride?
Oh, absolutely. I just wanted to give you more space to make that point, and to correlate it to those low vaccine rates
I
in
appreciate
a
it.
later slide, I think. And I know anecdotally that, and if you want to speak to this, you can. I've heard from, the folks that are getting it, even at my age and around my age, sometimes it's being transmitted from the younger kids. Like, I wonder if you know anything about that. Some kids get it and then they might be transmitting it to their parents. They haven't had it.
Yeah, so, because children tend to have milder symptoms and maybe asymptomatic, it's even more important for us to get them vaccinated, because they're oftentimes, especially in vulnerable communities, in households with multiple people across many ages. And so to have young children that may or may not fare better from the outside, even though, again, you don't know what's happening developmentally, you don't know the long-term impacts of even a high inflammatory state in children. We need to be proactive about getting them vaccinated to decrease transmission for the other members of the communities who are at much higher risk.
Thank you.
So when you mentioned the opportunity for education, especially from peers, are we still partnering with the regional response team, with Prepare STL, to go into communities to do these types of educational events? And I'm thinking specifically of our early childhood partners. It makes complete sense to talk to pediatricians, but you also have childcare providers who have access to families who might be willing to host these types of conversations and share this information.
I love that feedback, and that's why you're my favorite. Because I have a meeting on the books with RRT for next week. We touched base briefly this week, but the feedback around Prepare STL is one I hadn't embarked on yet. So I greatly appreciate that, because you're right. It's those early childhood development centers and thinking about where parents will be more comfortable, and really taking advantage of the next 3 to 4 months where weather will allow us to do that more flexibly than we will in the wintertime. So absolutely. I'll follow up on the Prepare STL, but we are scheduled to meet with RHC and RRT in just next week.
Great. Lisa, you have your hand up.
Yeah, I was just echoing what you said, Serena. I want, and you're much more tuned in than I am, but Dr. Mahdi, is there anything I could do? I don't have any networks. I live in the Central West End. I'm a grandma. I'm extremely concerned about this situation for every child, and, here and unborn. But, is there anything a volunteer like me could do to help y'all?
Yeah, I think, Lisa, it would be great from, the communications, even the liaison with our PIOs, to talk about we have a sustained campaign strategy. So our social media channels every week now do sustain. We're doing videos, we're doing infographics weekly around children and education. But it would be great to kind of diversify from the sort of check our website, log on to social media, to get more proactive and more widely distributed campaign out. That's one way. And with a lens on equity, really getting folks from all communities involved. And then secondly, like Serena said, I think once I get some distinct partners, met with BJC, they're helping me around us. We've just started a program where they use a call center to call homes, and then people who need vaccines, we schedule time to take our mobile van and go straight to their home. So that hasn't lifted as much as I'd like, but I think we can think of innovative ways to really uplift that, especially around children. And then again, to Serena's point around RRT, Prepare STL, and known trusted leaders who've been able to do this in a sustained, successful way throughout this pandemic will be critical. I think those are the points that we can touch base around, Lisa, and then make opportunities for volunteers like yourself, but I think more specifically around the education part with the PIOs. I think getting you in contact with Jasmine's on this call, and I just also want to shout her out. She has really, since coming onto this role. Jasmine, you've been with us for what, 6 months now?
Yes, it has been 6 months since February. Yes, I started in February.
Yeah. So 6 months now, and if you haven't seen, just look at the literal facelift that all of our social media accounts, the innovation, the change. So I think she has been very excited to talk campaign strategies that are broader than just social media. But I think this is
Okay.
an important time. You know, what can we do around getting things on buses, bus stops, and other prominent places. So I think getting you, Jasmine, to make it a point to please reach out to Lisa to schedule a meeting around the communications committee here, helping with the Sustain campaign.
Okay, great. I'm always concerned that the people we're trying to reach understand what we're trying to say and don't take offense at it. So my instinct, no matter who we're talking to, in what situation, is to kind of check that what we're trying to say is what they're getting at, and what other questions do they have, and what images turn them off or turn them on. So Jasmine, I look forward to talking with you about that, how we can work on that. I've been kind of underground for a while with some family problems, but I'm happy to get engaged again.
Yeah, between that and when I talk about monkeypox later, those are the two main places that we'll do some sustained campaigns. So thank you. Any other questions or comments before because you're going to hear my voice a lot for departmental updates, so I'm trying to get you a little break. Anybody else?
All right, doesn't look like we have any other questions on this topic, so we'll move to our next agenda item. Thank you, Dr. Mighty. So Linda Racklin was not able to make it to the meeting today. She had a scheduling conflict, but she had an item that she really wanted the board to discuss. Every month when we're preparing the agenda, I send a draft out to Tim, sometimes to the committee chairs, and I ask if there are any topics that we want to make sure we include. And one thing that Linda wanted to ensure that we discussed was the recent Supreme Court ruling overturning Roe. She was really interested in figuring out how, as a board, we can put forth a resolution to really support what Dr. Mahdi has already started, what the Board of Aldermen has started for the City of St. Louis in establishing this equity fund, equitable access to reproductive health fund. So one of the things that we talked about was presenting a resolution, but before we draft something, we wanted to check in with board members to see what our comfort level is, our desire is around how we should articulate this. So I'm going to try to facilitate this conversation by offering up what Linda has suggested would be good items to include in a resolution. The purpose of the discussion is to really think about what we want to put forth, what language makes the most sense. And once we have that, Linda has agreed to take that information and turn it into a resolution that we could then adopt at our next meeting. So just wanted to be clear that our intent is to hear people's perspective, and then Linda has volunteered to actually turn that into a document that we can all review and approve at our next meeting. So I'm going to use the chat for this because I want to make sure that I'm getting the wording right. And she basically had some specific questions around exactly what we want to say in this resolution. And of course, this is rooted in what Linda thinks would make sense for us to consider. So I'm putting this into the chat. There are 5 different sentences, and the way that I'm going to approach this is put in one at a time. And if folks have questions, if they're like, what does this mean? Why is it worded this way? We should change this or that. I can make those edits as we go. So we don't have working committees that do this type of work. This is something that as a collective we need to do in our open meeting. So I want to make sure that it reflects the sentiments of the group and not just an individual person. For the first statement, do we want to have a resolution that states that we support sexual and reproductive freedom for women and persons with uteruses? Again, you can unmute, you can discuss, you can type in the chat, but I'm trying to capture whether or not this is a statement that we want to include in the resolution. Comments or questions on this one?
I'd like to start just by acknowledging Dr. Colleen McNicholas formally. If you haven't, if you've just decided to close yourself off to all news and social media, you may be one of the few people who've missed this. She has been championing us at the federal level. She's spoken to our vice president. She was at, I don't know these political things, Colleen, but this hearing that you're at, what are they called officially?
It was a congressional hearing.
Yeah, so she has been at congressional hearings, really championing the rights, the fundamental rights for women, people who identify as women, and people who have the ability to bear children. She has done so always with a lens of equity in mind. I am deeply proud and honored to serve beside her on this board and just in life. And she symbolizes for me the people that we need to thank, because for a lot of us, this fight started on the day that Roe v. Wade was overturned. It's important to know that leaders like Dr. McNicholas have been fighting this fight, knowing this day has been coming for years and years and years, and investing into our city and our region so that women, and especially women of color who are disproportionately impacted in our region, have access to life-saving therapies along reproductive rights spectrum. So I just wanted to acknowledge her, thank her, and all of the partners that beside her in the city and the region who've been doing this work. Back to you and to the question at hand. We needed to shout her out because she really has been championing us.
And I didn't want to put her on the spot, but I know that
that's my favorite place. Just on the spot is my favorite place. I do it to you literally maybe 3 times a meeting. But Colleen, did you have any thoughts to kind of help start the discussion around the question that Serena has?
Yes, first of all, thank you so much for the kind words. It certainly is and has been a long fight, and will be a long fight ahead of us, but there's, I think, a path forward. So I have I've gotten to see the 5 questions that I think that Linda has proposed. And I think there's lots of overlap in the questions. And so, I think a resolution that is broad is important, but I also think we need to specifically name abortion in the resolution, because one of the things that I feel really strongly has gotten us here is the stigmatization and isolation of abortion as something other. And so whatever we decide is the language, I'd love to see that the word abortion is actually included in that language. And I'm going to step away for just 1 second. I'm sorry, my kid is very sick, not with COVID.
Sorry,
at least it's not positive yet, I should say that.
Thank you. So I've just gone ahead and started to post all of the statements in the chat so that you can see them in totality. So to Dr. McNicholas' point, some of them are very similar. So I'm sure as we are finalizing the document, we can eliminate any redundancies, but these are the main elements that Linda wanted us to think about and consider. So I have them all in the chat now.
If I could speak up, and Colleen stepped away, so I can't embarrass her with echoing Dr. Mahdi's eloquent comments. So I can't do better than her, but I 100% agree with her comments about Dr. McNicholas. But she's a real champion. But I 100% support that we should do something like this. Because it's so important for maternal and infant health. So all the questions are in the chat. In addition to, I'm glad you just put that one in there, because I'm very concerned about what's going to happen to contraception and all that. And I agree with the point that Colleen made about abortion too. So.
All right.
I just
So-
want to make those points. Thanks.
Thank you. So I won't belabor the discussion. If there are additional comments or questions, feel free to type those in the chat. If at some point during the meeting you're struck by a thought and you want to raise your hand, we can circle back to it. But I want to make sure I capture this in our meeting so that the notes that I give to Linda reflect our consensus and not just kind of the input from one or two folks. So if I don't hear from you directly in the chat, then I'm going to be messaging you to make sure that you're on board and that you don't have any questions or concerns. So
Could
I
you
want to
send
close.
us, I'm sorry, could you send us, Serena, the text? I want to look at it and read it and raise some questions
Yes,
about some of the words, you know, just from a non-specialist perspective.
yes, I will definitely do that.
Because I don't know that we can, are we supposed to sign off on it today and then send it to the Board of Aldermen today? Okay.
No, no, no. Today is
Okay.
just discussion and feedback. And as I mentioned, I'll take the notes from this discussion and give them to Linda for her to create a draft, and then we'll react to the draft of the resolution. But I
Okay,
can
cool.
definitely send this to you as well.
Okay, well, I agree. I would agree with Tim. You know, I agree we need to do it. I support it a lot. But I think some of the general, and I don't know that we need to educate the public with this statement, but I think a lot of the public doesn't know the details. I mean, I've been following the issue at a kind of a increased level, but there's a lot of information about the situation where abortion is necessary that I don't think, unless you've been in it yourself or your best friend has, or your mother or your sister, you know so much about the why this is why this is an important public health treatment, why we should all be concerned about it. I don't know that we can put that in the statement, but I'd like to think about the words and just knowing, you know, what they might represent to people who oppose this. But definitely agree we should do it.
All right.
You know,
Thank you,
if I could add, I don't know if the words are in there, but it might be worth adding. In recent days, I've been so alarmed by what I've been reading about attacks on or concerns and fear among physicians about their freedom to do the work that they do. So of course, I've been worried for a long time about freedom of choice for patients, but you know, because of freedom, you know, fears that they might be sued or charged or whatever, you know, it appears that physicians around the country might be fearful of treating miscarriages or, you know, doing certain things like that. So if we could think about wording to that effect, that has a public health effect. You know, so, you know, let's just let doctors be doctors, you know, freedom of the right to do what they're trained to do. I'm not being very articulate about it, but if we could think about that.
Okay. Got it captured.
Health
right.
practice for half the population or over half the population, or population at a certain age range. I mean, it's just general health.
Serena, are we supposed to write on the chat if we support this or not? Is that how you want us to do?
Yes, please.
Thanks.
Thank you. All right. I know that it's on the agenda that we have board committee reports, and I check in with the committee chairs. I don't believe that we've had committee meetings in the past month, but I'm going to just go through the list, and if we have one, we'll stop. Timothy, did you have your hand up?
Yeah, we did. We had a board meeting or a committee meeting. You want me to give a report?
Sure, you can go first. The Academic Public Health Collaborations Committee.
Yeah, so we had a meeting. Craig Schmidt and Will Ross and I met. So you charged us with, you know, making sure that we sort of do that work. And actually, I'm going to put something in the chat about what we talked about. And then I'll talk through it. Bear with me for a minute. So there was the agenda that we talked about. We talked about membership. the purpose of our committee and data funding. And so we talked about who's on our committee, making sure that it be broadly representative. Obviously, we have a couple of members from WashU at this point. We want to, reach out to SLU and UMSL, maybe Harris Stowe as well. And so we're thinking about that. In terms of purpose, we talked about some of the things that are listed in the chat, using the academic expertise to advance principles and practice, and helping the department enhance its workforce through use of students, trainees, interns, that sort of thing, and hiring new staff. Probably should put that in there. And academic public health collaborations, including bringing in more funding, is some of the purpose. This is sort of a draft of things we discussed. We talked about data collaborations, and a lot of that has been enhanced in the pandemic public health emergency, as we all know, and ways of continuing that work. And we talked about funding issues because Craig had given us a briefing of how the funding that's kept that academic collaboration going has ended. So we will think about how to continue or to look for other sources for that. So that's kind of the discussion that we had. I'd be happy to entertain any questions or comments.
Tim, is this committee or is this group regional or is it city only?
I don't know if we entertained that question. Craig, you can jump in.
Yeah. It's been regional, and I expect that it would retain that flavor. Yes. But for these purposes, obviously the reporting is here. But yeah, no, it's been St. Louis County, St. Louis City.
Okay, thank you. All right, are there any other questions for Tim or Craig? All right, thanks, Tim.
Sure.
Do we have a report from the Governance and Nominating Committee? I know that's Linda's committee, but I don't know if she charged someone with reporting on her behalf.
Yes, Linda cannot be here. She's on the road and without computers. So what she wants me to say is that we did not meet at all on last month, and but she also wants us to know, want the board to be aware that the February is coming up, and if anyone wants to continue, let us know to be in the board, or the one that is rotating out, we'll make that clear also.
Right.
Dr. Shifra, have anything to add? Welcome to. I think that's what she wants me to tell everybody.
All right. Thanks, Paul. I know we were also waiting on orientation for new members. Was that discussed at the committee?
No, she did not say anything like that. She just yeah, basically just the board member who served 2 terms needs to rotate out, and they and whoever has not can also opt to join back in. Just let us know. No, she did not say anything on that sort. I'm not sure where she's at that about the orientations.
All right, thank you, Paul.
All
right. Lisa, I'm pretty sure we have not met as a health communication committee. So, okay, we're good. Thank you. So I will move to our next agenda item, departmental updates, and turn it back over to Dr. Mahdi.
I am very excited to debut a new format for presenting departmental updates as part of an overall new approach to implementing key performance measures and organizational infrastructure to the Department of Health since I started here. I want to thank Shantae Fluton, who is not here, who I hired about a month ago, but was previously with the Health Department, who dove right into the role of assisting. My thoughts here is that I will now be providing monthly updates to the Board of Health, Board of Aldermen, and Mayor's Office, and key partners, as well as an annual report for those entities and for the city and region in general at my 1-year anniversary. This will really help us to understand the diverse roles of the Health Department. It's easy to think we are just here doing COVID, and to see the growth and areas of concern along the way. It takes a lot of work for the staff, and I want you to really be be proud of them for the work that they've put in. I also want you to know that this right here is open for redlining. We know we need to get you something to get us started, but I anticipate, in fact, I expect and will be disappointed in you, my partners, and other key partners, if, again, Serena, you are gonna be sad for the day you asked me to give clear guidance of where I need feedback, Serena, because I am on a roll now. But I need feedback on whether these key performance indicators that are coming from national and state level accepted performance indicators in public health, but are these the sort of numbers that you need? Is this the sort of format and presentation that is helpful from a report standpoint? And how can we improve? We will not take it personally. We are fully aware that we're about to be inundated with feedback. We welcome it. And I also want to say that I am extraordinarily proud that without budget, with zero budget, I have found a consultant partner in Spring Smith, who is the current leader for MOSEFI, to come in and work with the Health Department around this new strategic plan I have around organizational infrastructure, key performance indicators, and an operation, a very distinct operational plan for the Health Department. And so she will be working with us on this plan too. So instead of talking about it ad nauseum, I'm gonna get to actually presenting it. I don't know what I just did. Something bad has happened to my computer. What are you all seeing right now?
Is you
Nothing.
looking concerned?
Okay. I'm going to describe this as best I can, and somebody who understands Zoom. My screen is frozen with this blue bound like barrier, and 1 and 2 on both of my screens, and I can't go.
It sounds like your monitor is no longer receiving the feed from your computer. Like, are you doing some type of projection or?
That's alarming. No, but let's try to resolve this issue expeditiously. You still just see my concerned face, is that correct?
Yes.
Okay. Two seconds, I'm so sorry.
No problem.
Even after 2.5 years, I'm very Zoom challenged. So I'm gonna start by talking about emerging issues with you, as this is gonna be one of the key areas that I'll be reporting back. So first, monkeypox. On July 12th, the first probable case of monkeypox was found in the city. Additional monitoring response.
Dr. Mata, do you want to send it to me and I can try to screen share it?
No, it's just popped back up. We're good.
Okay.
Back. We are back. But thank you. All right. Isn't it pretty? So pretty.
Lovely.
I have the best staff in the land. Look at this. City of St. Louis Department of Health monthly report, June 2022. There goes your arch. My office is very closely downtown to that. All right, so first, in the month of June, the Department of Health had many amazing opportunities. We hosted a virtual town hall where the DOH team and I had the pleasure of responding to great questions regarding continuing concerns. We had over 50 people for that. no, that's a lie, I'm sorry, over 110 people, I'm sorry, and broke our own personal record. I thank you for your support. For the first time since 2019, we were able to support Pride in St. Louis. And I want to say, we had a really impressive number, and I want to get that to you, of people who showed up. If Suzanne's on the call, you can unmute and say, but I think it was, we engaged with over 1,200 individuals through 2 days of Pride, giving critical public health information. We were able to express our commitment to support the mayor's efforts to champion for reproductive rights in the wake of the reversal of Roe v. Wade. And following this meeting, I will be moving towards the signing of Board Bill 61 that we discussed earlier. We also shared with the community the need for more people to join our team. In June, we hosted a virtual job fair where DOH leadership team introduced themselves, shared information regarding available positions. We invited the Department of Personnel to answer vital questions. We had over 50 participants for the first ever virtual town hall, and we received 44 requests for additional information. I now do a monthly hiring report, and I want to say that while I have hired over 36 individuals since October, since I started in October, we have lost 23 individuals in the health department. You need to understand why that is so alarming, because that level of turnover that has been consistent in health departments, and I do an exit interview where the two most concerning areas are salary and burnout. The mayor has started to address this. A 3% increase across the board for salary for city employees went into effect in July, and a $2,000 bonus. But unfortunately, we're still woefully under par for where we need to be for that. So I will be requesting for the fall appropriations of ARPA allocations for workforce development, retention, and value adding incentives for staff. And I'll hear more about that. Would appreciate the support of the Board of Health at that time. So let's look at some areas. So we talked about emerging issues. We had the first probable case of monkeypox in the city of St. Louis, the reversal of Roe v. Wade, we talked about that, and the COVID-19 updates. And you see some key figures. I joined CBS News to talk about the new BA4, BA5 variants. We've put out a lot of educational information around Roe v. Wade. And again, Dr. McNicholas and many other leaders and I have been joining the community in really speaking to the fundamental reproductive rights for women. We had a very distinct and great presentation for COVID, so I'll pass through this part of the report. Let's talk about violence prevention. Cure Violence Global Team is currently working on streamlining some data and reporting elements for better understanding. We now have this monthly report. Gun violence has a seasonal pattern, which is on display in the graph in the middle here that shows gun violence charges in the city of St. Louis. So assaults, robbery, and homicides seen in descending order. You see here 97 high-risk individuals under case management. We have 19 in the last month, potentially violent interactions interrupted. That is phenomenal. And this is by trained violence interrupters and outreach workers. We've had 6 community events, 63 referrals for employment, housing, or financial aid. These are great metrics that we need to be shining light on how we are having a public approach to violence prevention in the city. Behavioral health. I am proud to announce that we will soon be debuting the new Behavioral Health Bureau for the city of St. Louis. I am currently in partnership with CDC National after an extraordinarily successful visit with the director for the CDC as the first health department to ever get a visit from her during her tenure. They have now partnered with us to provide 6 salaried with benefits full positions from the CDC to get us high level of expertise to start the strategic planning process and beginning implementation for this bureau. We have 12 interviews lined up with the CDC through this partnership starting next week. We believe the 6 individuals that they are giving us will be in place. They will be available to us for a year for that real initial phase. This allows us to get the 14 salaried positions that I was successfully able to champion through this year's budget for this behavioral health to be interviewed for and to staff people and bring them on board. So let's talk about the data before you. We're seeing fewer ER visits for overdoses, but a higher case fatality rates related to increases in the availability or contamination of fentanyl and its derivatives. For this reason, one of the first 2 initial projects that we're focused on in a collaboration with CDC and state will be to address the overdose crisis in the city. ER visits for suicidal ideation and self-harm has also seen a decreasing trend over time. Our main partner here is the Behavioral Health Response, BHR, who have been doing a call diversion contracted project with us that you'll hear more about here, and I will be inviting them to attend a future board meeting. And so we've seen a reduction of roughly 22% from 2018 to 2022. So in the past month, 85 emergency room visits for substance and abuse and overdose in the city, 192 emergency room visits for suicidal ideations. Still too high, but trying to show you the overall trend and how our response to this over the last a year and 6 months has really shown some encouraging improvements. Let's talk about public health information and health promotions. In the month of June, the Department of Health has had so many amazing opportunities to connect with the people we serve. We talked to you about that virtual town hall. We talked about Pride. We talked about our commitment to reproductive health justice. We shared 2 joint press releases with the St. Louis County Health Department. I've previously spoken to you about this collaboration that I initiated in October when I came on with monthly leadership and joint board of health leadership meetings with the county. So we've had 2 additional joint press releases. We also shared the community the need for more people to join our team with the virtual town hall. I want to show you some incredible metrics. We have increased by over 300% almost uniformly across all platforms since I joined the health department. 10,843 current Facebook followers, 564 Instagram to come to the new platform. We have increased 78% visits to our Facebook platform in the last 38 days and have really increased our presence in the Twitter atmosphere as well. In the middle here, you see this new weekly format for giving what we call our COVID-19 data snapshot for the city of St. Louis. This is every Thursday across all platforms, a really concise, colorful, visual way to understand what's happening with COVID. And there's always a quote from me to accompany it and a blurb to really explain what the data that you're seeing. That's every Thursday on all social media platforms. And you see the press releases that we've had speaking about rising cases and hospitalizations of COVID, vaccines, congenital syphilis, which is an absolute health crisis within the city right now. We've seen over 600% increase in congenital syphilis cases over 3 to 4 years. We'll be sharing that data with you in coming weeks. So in talking about our fiscal, workforce, and current grant funding, I'm really proud here. Only 2 months ago, we were down to 2 accountants for the whole department. We have now hired an additional 3 accountants, an account manager, and I've gone into a professional services contract with a prominent accounting firm in the city for 1 year to do audits, critical trainings, and implement better organizational infrastructure tracking and recording for the fiscal department so that we can better serve the city. So the fiscal team was successful in meeting the comptroller office deadlines for fiscal year closing. All purchase requisitions and contracts were submitted by the deadline. We also submitted financial reports and budget transfers to the Health Resources and Services Administration by the June 10th deadline. Although we've hired 7 new staff members, we also lost 7, right? That was what I had to bring back in. So the retention piece, the retention for all this work we're doing around hiring is so critically important and has to be an area that we would ask for support and for you to be a thought partner with me around that retention piece. To date, we have 44 open positions. And so percent of health department that's grant funded here is 52%. We have had 35 requisitions in the past 5 months and a number of days to process an invoice to being submitted for the day the check is issued is 7 days. These are KPIs that I'm trying to improve how we address our fiscal responsibilities. So communicable disease. The HIV team has shared 277 at-home HIV self-test kits in the month of June. This is part of an Ending the HIV Epidemic program that we do around specifically really utilizing at-home HIV self-test kits to provide better resources from an equitable standpoint to the community. This number includes kits shared through the Take Me Home program, where anyone 18 and older can order an at-home HIV test kit at no cost. It's shipped directly to participants with clear instructions in English and Spanish, along with resources to guide individuals. I talked to you about Pride and the team, again, sorry, I lowballed it. It was 1,976 visitors to our booths and received education, as well as 10 volunteers who circulated throughout the event, promoting at-home test kits and the Take Me Home program that I just described. New and AIDS case totals were similar for the same monitoring period as last year. And we are hiring for a clerk and 2 specialists to enhance our services. And so again, I'll let you just take a look at some of the goals that we've identified for this department, identifying persons with HIV infection, and I've identified people. And so our clients screened for risk factors and counseled 7 people in the last month, developing services for at-risk individuals. Again, people who are 43 people eligible for PrEP were referred to care just in the last month. And a goal of improving reporting of communicable diseases. So number of cases investigation with 2 weeks of assignment were 26 in the last month, high priority of cases with live contact within the same business day or 2. And so again, you'll start to see in monthly reports, I'll be giving percent increases. You'll get to see what's, the rates of change to really give you an overall idea of how we're doing. These are other important places that we monitor: hepatitis B and TB. We do a lot around TB to control transmission of tuberculosis and prevent illness. It's important for you to note that we are now also servicing the Ukraine parolees, they're called. It's a different designation term than refugees. That's also really increased our traffic in our TB clinic because they have a lot of screening services that they need. We do a lot around hepatitis B, and I'll let you take a look at those numbers before you. Maternal and child health, the LEAD program completed 771 educational sessions. Information including asthma is included in CPR training, facilitated by DOH maternal child health team. So a couple of goals we have here is to decrease rates of childhood lead poisoning in the city of St. Louis. We did a lot around follow-up case management, 112 cases in the last month alone. And then another goal of reducing emergency department visits for children under 5 with asthma. And the number of educational sessions we provided to community members in the last month was 6. These are some other goals that I won't spend a lot of time on, but around maternal health, we've got some new funding there that we're excited about, and immunizations. Outside of COVID, we do a lot of other immunization work across the spectrum for children. And so we have goals here around health programs with vendors and stakeholders to increase vaccination rates to 95%. So we're tracking those numbers both with our partner Affinia and in schools as well. Chronic diseases, we have a food outreach program with Gateway Regional to connect metro area residents who are at risk for diabetes and hypertension to the YMCA health programs. We referred 6 residents for lifestyle change programs. We delivered 2 prepackaged food bundles to residents in the city. But we are in need of a nurse to lead our Show Me Healthy Women program, which provides professional nursing case management services to ethnic minorities, low-income women, 35 years and older, in St. Louis and the 4 surrounding counties. So we are definitely trying to be aggressive about that. Our environmental health services, so food and beverage control officers inspected and monitored 20 vendors who sold food during the fair St. Louis activities. Temporary food permits have been successfully transitioned to a new online platform, CityWorks, which is great for streamlining services. And we have an intern who's helping develop print materials addressing good hand washing practices and other common violations for food and beverage as well. So one of our goals here is to reduce food-related illnesses through routine food and beverage inspections. You can see some really great metrics that we're already in today, and some visualization of where we are around our monthly food inspections here as well. Community sanitation responded to 213 complaints regarding landlord-tenant issues or environmental hazards. Seasonal pool inspections continue with 31 completed in the month of June, and an additional community sanitation inspector was certified by the state to perform childcare inspections, which is going to help us tremendously. Again, I'm letting you just sort of take in some of these goals, look at some of these metrics as well in these core services. Animal care and control, July 10th was a very sad day in our city. We've responded to a call from SLPD regarding an animal attack. After a thorough investigation, 3 dogs were secured and continue to be housed at the city animal shelter. We are just incredibly saddened by the loss of life that resulted, incredibly proud of the team for being directly responsive, and we're now working with partners in the region to see how we can better support our team and our shelter to, to continue with the really strong preventative measures that we have in regards to these unfortunate incidences. We're working with the medical examiner's office to continue ongoing investigation into that incident. So that investigation is ongoing. Currently, we have 4 full-time officers. You'll remember when I came, I only had 1. We have 1 per performance officer on top of that and 1 supervisor. So we've gone from 1 to 7 people in that department total, with 6 new additions. And we are planning on enhancing our 24-hour response team. We're in need of 2 additional supervisors and 11 officers. So while we have a way to go, we went from 1 in October to 7 in the department, and that's really helping us. The biggest challenge here has been attracting quality candidates. We are part of a reaccreditation process. This is ongoing. Rhonda Bartow, Craig Schmidt, and the team are to be highly commended with their leadership here. And we have a community health improvement plan, the CHIP, which is taking a regional approach by working in collaboration with the County Department of Health. We've completed all community assessment, waiting on final outcomes report. We're currently working to determine the National Association of County and City Health Officials recommended prioritization tools, which we'll work with an advisory team on. So I will stop there. This was a lot in a very new format. We'd just be interested in how helpful this was, what you'd like to see more of, less of, and of course, as usual, any questions.
All right, thanks, Dr. Mahdi. Any questions?
I think it's really great. Does it take a lot of work to update month by month, Dr. Mahdi, now that you figured out the format?
Thanks, that's a great question. Because of this incredible team that Shantae leads, we have developed a really easy system for our leaders to input. And prior to this, they were being asked for different reports for different entities. I'm making one streamlined effort that goes to all of the entities, so that also decreases their work. But more importantly, they understand that having these KPIs at their fingertips, having a monthly report, tracking this over time, helps them to really respond to the needs and changes as they arise. So again, the approach I took, and they may not love me as much right now, but I'm hoping in 6 months they will appreciate me a little bit more, is a lot of work on the front end to really get to where we need to be. So it's less about showing off and being able to have some fancy slides. It's really about having them have an informed approach to implementation, prioritizing implementation strategies to really help our city's public health. So again, we have developed and we'll be working with our consultant around the best way to do so. But again, our epidemiologists really stepped in to work with our QI specialists here to provide Excel spreadsheets that already have predetermined numbers that they just need to plug in each month. So the onboarding process and the change was the hardest, but now that they've gotten the hang of it, this will be easy. We have exactly the same deadlines each month for when this is done. They have support staff both in EPI and in QI to help them if there's any questions.
I think it would be great if we could someday get to an even more condensed format of that you could put on Facebook, that I could send to all my friends who live in the county, et cetera.
Yeah.
And, that'll also help explore St. Louis, institutions that are trying to get more people to visit us and see that we are a responsible and increasingly healthy city. So I think it's fabulous. Thank you.
Thank you, Lisa. Comms background person said it's fabulous. You can't tear me down today.
Easy to understand. That's my definition.
But one of the things I was thinking about in response to that is I need to let my staff come up for air. I can't do a lot of change all at once. So I've been really, really thoughtful about little bits of change, pause for just being able to process and catch up. Next steps, right? And so one of the areas I'm moving towards is a newsletter type approach that's much more condensed, that you can do that exact thing. But for partners who are public health leaders and strategists, they need the metrics, right? So I need both. I need to start with this, right? Because you're not going to catch me slipping, child. But we need something that's a little bit more relatable and condensed and can be absorbed by the public. So sort of a newsletter approach that is very high level is where we're moving to in the next 3 months or so.
Yeah, well, I really love numbers. I think that specificity is important to, most people. So yeah, as you can do it, but I think that's a marvelous first step. And it looks like you did a lot of work. You and your team did a lot of work. So that's great.
Thank you for acknowledging that. It was a lot.
Yes.
Dr. McBride.
Yeah, thanks. This is a fabulous presentation, and I want to speak to the depth of it. And, I've been concern for a while, and that's the wrong word in a way to say that, I think the presentation's great, but we've been so focused on COVID appropriately. There's so many other aspects of public health
That's
that
right.
your presentation captures. And I've been on this board long enough to remember what it was like pre-COVID. And we used to think about all the things you just mentioned that were in the public health bucket. And my concern is not, a criticism at all, but it's just like, are we paying enough attention to all the other things that you just mentioned? And, to the point that you just made, like, to not overwhelm your staff. And I will shout out to them right now and just say, you and your staff do a fabulous job of presentation, of data reporting. And I think relative to the county, I think you do a better job than the county, to be honest.
Hey, listen, you're not gonna get me in trouble with my partners. So I'm gonna take a star from you, Dr. Brickwater. Thank you.
And so here's just a proactive suggestion, just remembering, just try to remind people of the depth of everything that it's in the bucket, and from HIV to animal control to everything. But, where you can help us as a board is to call out, kind of like the CDC's thing, like what's a critical thing that we need to be paying attention to. So, maybe, they're all of them, but, this month, I really want you to pay attention to HIV, or is it, XYZ. So, and, we're doing a pretty good job on X, but, so here's the 3 things I want to highlight this month, and that might help your staff a bit. And so that's just a suggestion I would make. And I am alarmed about the staffing issues, and I don't really know what the solution to that is. But anyways, those are my comments, and I just want to applaud everything you did.
Thank you, Dr. McBride. I really appreciate that feedback. It's hard because I don't have the luxury of picking one or more. There's never a time where we have the luxury to have one priority. So the emerging issues section that's always at the top, and when I send this out in email format as a formal sort of monthly update, I plan to have a highlight section that will help you get like the most intense things. But right now, for example, I can't just do COVID. I've just announced the first cases of monkeypox, and we need to have clear messaging and education, answering a lot of confusion in the public, especially around vaccines. But at the same time, I'm signing a bill today around reproductive justice, and we need to start getting that out and have clear communications as well. And animal care and control continues to be a central core issue. STIs have skyrocketed. So that's in parallel 5 priorities. So I'd love to talk offline about, is there a way to really responsibly whittle that down to 1 per month when there's honestly at all times in parallel at least 4 to 5, if not more, priorities. And so how do you prioritize and how do you message that? So at least for the first one, you're going to get attachments, but there will be one easily to condense, just highlights paragraph that says, these are the big level issues. As you're going through the details, keep this in mind. That's how I'm thinking about it, but would love to connect offline about other ideas to prioritize.
I hear your response, and I think that makes a lot of sense. I think you're right that it would not be responsible to not report all of them. Maybe in a way to do it is to report them all in a written way, but maybe in each meeting use the verbal time to talk about 1 or 2 of them in depth. That's just a thought.
Okay.
But I don't know. I'll think through it, and you know what you're doing in communication.
No, I think that format we had of having like a special presentation when it doesn't go too long, which means I need to look at the length of both the Covert and the departmental to get you maybe one that we talk about, is one I think we can do. But as far as approaching priorities, that's the one that I'd like to work with you a little bit more on.
Thank you so much.
So we have about 5 minutes. Are there any other questions or comments? I have one comment just on the presentation that I think, when possible, if there is baseline data or a target number, to include that so that we have some context to the numbers that are being presented.
I like that. Unfortunately, I was trying to get something out to you guys to see, but them being able to collate the data to this point as a baseline is something they're working on. So you'll see that in the next report. But that is the best feedback I needed, because when I was looking at it, I was like, this is really hard to digest what the impact is when you don't have a baseline to refer to. So my hope is that you'll see that more coming up, but I also want them to have sort of from my start moving up. So I appreciate that. Please feel free to email me since we're running out of time if you have other thoughts around this. When the email comes out with the attachment and the narrative, feel free to send me heavily redlined feedback. Thank you all.
All right, do we have any announcements? No announcements. Okay, so our next meeting, I didn't put this correct on the agenda. So if you looked at it, it was probably confusing. But our next meeting is August the 18th. So we can adjourn. Can I have a motion to adjourn?
So moved.
A second?
Second.
Okay, all in favor?
Aye.
Thanks everyone for your time. We will see you next month.
Great meeting,
Thank you.
Thank you.
leader.
Thanks, everybody.